I hope you are ready for today's video. You need to watch this video with an open mind and have your creative juices flowing because I am going to be interviewing a PA today who has built a business that is truly innovative in medicine and I feel really has the power to disrupt how medicine is practiced and also has the power to help you craft exactly the kind of practice that you want. Hi, it's Michelle with the Medicine Couch, and on my channel here, I am all about helping PAs and NPs discover all the possibilities open to them in medicine. And today is probably one of the most unique videos I'm going to be bringing you. I want to take a moment to thank my subscribers. If you haven't subscribed and if you like what I do, then please hit that subscription button down below and hit that notification bell so you know when I release a video every week. Okay, get ready to learn about this amazing platform, what it can do for you, but also how it can help you become an entrepreneur.
Hello, my name is Ricky Yarosh. I'm a physician assistant by training. I've been practicing for over 25 years, primarily in surgery. I've also launched several businesses, also mostly in surgery, but right now my primary focus is on a technology platform.
So welcome, Rick. Thanks for joining me today.
Thank you.
So why don't you start by just telling us what is this technology platform that you've developed?
Sure. The platform is called HealthGigJobs, all in one word. And it's a marketplace which matches and connects healthcare workers with employers for gig work type of opportunities. And we define gig, for the record, as any type of work that is done within 24 hours. It's important that people understand that because not everybody understands what a gig is.
So give people examples of gig work in other fields because it's kind of newer and unusual for people to think about gig work in the medical field.
A gig worker is someone that is, first of all, is not employed by any entity. They're pretty much self-employed or independent contractors by my definition. And I can give you several examples specifically with how we define gig work, even just in healthcare. If somebody needs to cover a shift somewhere, on urgent care for the weekend, or maybe just do some rounds, see a patient at home, and they do it sort of on an on-demand basis. It's not necessarily scheduled routinely, and they do it, when it's convenient for them. I call it a gig. I always like to compare it to Uber because a lot of people do that. Somebody can be a full-time Uber driver and that is their job. Others may just drive, on the weekend or on, Thursday night to make some extra money on the side. Those are all gigs. And same thing actually with our platform. We have people who are interested to do this in addition to their full-time employment, or somebody that just wants to work part-time and make a certain amount of money. Or, there's several that just want to do this full-time because they get sort of control of, where they work, who they work with, how long they work. So it kind of varies for each person.
From a locums standpoint, because I work locums, I was thinking, oh, it's, you pick a job for a day or for a week or however long you want. But you're saying that this could even be, as short as a couple hours a day if somebody is just needing some extra rounding help or something like that.
A perfect example of a gig, I work with, with a bunch of different surgeons. And there are a few surgeons that all they wanted me to do is to triage their phone calls on the weekend so they can spend time with their kids or whatever. So they forwarded the answering service to my phone. If it's something simple, I would just take care of it. If it was a consult or something that had a parameters, which calls I should forward to the surgeon, I would do that. But I would triage it. I would organize it the way they wanted. And it could have been done for 5 hours while they were on the golf course, or it could be done in a 24-hour cycle overnight because they wanted to get a good night's sleep.
You alluded to this story about how you came up with this idea. Why don't you go ahead and tell us that story now?
Basically, my original business, I was a surgical assistant, a PA in first assistant surgery, and I started working independently, like a lot of our colleagues do. And then it got so busy that I started asking my friends and also colleagues or somebody who would, actually had a job, can you cover, a C-section, or can you cover a hip fracture, et cetera, et cetera. And it kind of, started to grow very quickly. So I really created a real business. And as it grew and I got over 10, 15 people, it was very difficult to manage them because it's not just about having somebody available. You have to know where they're credentialed, what skills they have. Are they compatible with the surgeon? Can they do orders or can they not do orders? All that stuff. And in order to sort of make it a very efficient system, I'm fortunate enough to have very talented friends that can build stuff technologically. So they said, yeah, we can build, like a filtering, system, scheduler, etc. So that's how the whole idea originated. And then as the company grew to, over 100 different surgeons and in different locations, we really kind of expanded on that system where we created filters by, schedule, call schedule. I had employees, direct employees on a salary, so I can actually control their schedule. And we also had independent contractors, and they would prefer to get paid differently. Somebody wanted to get paid per case, regardless if it's an hour or 3 hours. Somebody wanted to get paid based on the percent of reimbursement. So because of that, we also built an additional function in terms of different types of payments. So that was the original sort of seed that was planted. And then just to fast forward many years, I got a phone call from like one of big workers' comp companies. And they ask, do I have a capability to provide one PA or a nurse practitioner in every single state to do like workers' comp assessments within 1 hour after the incident happens? The light bulb just went off. I figured, I already have this system, which kind of like more, enterprise worker management system. But what if I can build something that would allow anybody who has a specific license to work whenever they feel like working and just make themselves available? So I, made a phone call to my friend and said, well, can you build something like this? I said, sure. And then, how much are you going to pay them? And I said, I don't want them to work for me. I don't want to be part of this. Let them negotiate it. So that's what HealthGigJobs is now. And I will always have to make it very clear because it's kind of innovative. Nothing like this exists to my knowledge. We are not the employer. We're just a technology platform. So nobody works for us. We don't set the price for the gig. We build a functionality, which is so cool and so unique, where kind of like Priceline, where the worker or the business or the employer can actually set the price for each specific gig. So it's a dynamic bidding platform. And as long as they agree on a certain price, our system records it. And when the gig is completed and it's verified, then we actually, we process the transaction on the back end of it so that the worker doesn't have to invoice, the client, etc. So, and then we charge a booking fee. That a lot of people ask me, I might as well jump ahead. A lot of people ask, how do we make money? Because it's all free to register. So, well, we charge a booking fee like Airbnb does.
Now, the booking fee, is that paid by the
By
employer
the
looking
employer.
for?
Yeah, it's completely free to the worker. And the employer pays us a very small fee because the employer doesn't have to pay a recruiter, doesn't have to hire locums or staffing company, which can be very expensive, and they don't even have to use a job board because a lot of people think because our name is HealthGigJobs, we like a job board, and I already seen that feedback from people that registered. Like they enter the information and then they expect to see lists of gigs, where are the jobs. It doesn't work that way. You only see gigs that specifically match your criteria. When those gigs are posted, then you'll get notified.
And I assume you can kind of set those filters or parameters as narrow or kind of as broad as you want.
Yes, very, very. Yeah. It's granular. So, and it goes by experience, like say geographical area. For telemedicine, it's quite interesting. There's you can click telemedicine. So then, the zip code doesn't really matter as long as we verify that, you're licensed in the state. Then you could be matched for that. But sometimes when employers post a gig, they may click a required button. In other words, they want somebody who definitely has experience in that specific specialty. But others may not click that. In other words, they don't really care what specialty or background you have, as long as you are licensed and you can do a certain assessment. That's what they're looking for.
Do you think this is something that somebody just coming out of school can do, or do people really have to have like years of experience under their belt to be able to do this?
The short answer to your question is absolutely new grad friendly. Now we do require a license to register, but full disclosure, because we're getting additional requests, which I didn't expect. We're modifying the version to allow students to register because there are gigs now that are coming in which a healthcare student can do. It's quite amazing, but that's another conversation for a later time. But for recent graduates, absolutely, they can register. What the platform will be able to do is, first of all, while they're looking for their perfect job, they can still do some gigs on the side just so they can put, food on the table, look around. It kind of alleviates that pressure that I have to get a job, And others, truth be told, they just get whatever job they can. So at least they're working while they're looking. And that's fine as well. If somebody works in, say, emergency room, but they want to work in dermatology or, some other, specialty, they can start doing that by doing just gigs on the side, just kind of get your foot in the door and see if you really like it or not. And that is sort of what I think makes me passionate about what we do, is just empower that person to do whatever they want to do when they want to do it, and they can even name the price that they want to get paid.
Yeah, that does seem like it gives people a lot of flexibility and ability to sample different things. And because you can control your price, if you're somebody that has lots of experience and you want to do a gig in a certain area, but you want to charge, a high dollar and you put that out there, you get it, great. But it also gives you the flexibility if you are scrappy and you're somebody who wants to come in and even underbid so you can get in and get experience somewhere. It gives you that great flexibility. I love that about it.
Yes, and that's what I tell my colleagues and members, that if there's a specific specialty or area that you want to get into, don't increase the price and bid yourself out of the system. Do it maybe for a little bit less, or at least whatever you feel is fair for your level of experience. Get into it. If they like you, there's a good chance. First of all, there's a rating system, just like any marketplace. You can rate the employer can rate you, and you kind of get that ranking. And then as a worker, when you feel more comfortable and more confident, you can then increase the price. When the employer, which could be a doctor, clinic, telemedicine company, you name it, when they post a gig, they can actually name the price that they're willing to pay, which then can be negotiated on the platform like eBay or Priceline. Or what I actually recommend to the businesses is post a gig, but leave the price blank. Let the matched people name their price. And that's the unique feature of the platform. They can see simultaneously all the people that bid for a specific gig, and then they can choose who they want to engage with. Now, what's important for everybody who's listening is that doesn't mean that the employer will pick the lowest price. No, they will see, they have the ability to see the basic profile. They may want to pay higher for somebody who has maybe more experience, or maybe somebody who lives closer to them. So it doesn't really automatically, I don't want people to assume, well, just because I'm going to bid low, I'm going to get it. It doesn't work that way.
So for people like me who are familiar with locums, or people understand how locums work, how is this different than locums?
The first two things that just flashing red is, number one, there is no contract. With the gig work, it literally can be a couple of hours, etc. As far as I know, and you can correct me because I've not done locums, I just work with a lot of them. There's usually like a week's contract that you have to do, and certain obligations, and not everybody necessarily likes that. Number two, and that's a big point of the platform, is that you name your own price. You don't have this middleman recruiter or somebody who's kind of negotiating for you, and plus getting paid for that as well. If I'm a clinical or a doctor, first of all, I may not have a budget to pay a recruiter or some locum, right? But even if I do, if we eliminate the middleman, I may end up paying less than what I would have paid directly to the worker, and the worker would probably get paid more than they would have earned if they went through a recruiter, because we're eliminating that middle person, and plus we get it on demand very quickly. So that's the essence of what the platform is doing.
Just for the audience, for people who haven't worked locums, you see these jobs advertised and you talk to the locums agency, and you have a little bit of negotiating room if they're advertising a job for like 65 an hour. But that 65 an hour, I mean, the agency is probably being paid like, $100 an hour, or yeah, 90 or $100 an hour. And they are taking all of that extra money because they are, like you said, the middleman. Now, they do provide you with some services, as far as like normally you're covered with a malpractice insurance that they're covering you with. And sometimes they do offer a few different, benefits, and you've got a contact there if you have any issues and things. So they do provide a service. I'm not saying that they don't, but a good portion of that money that is being paid by the client is going towards that middleman person, the agency. So this is just a direct way. You are dealing directly with the company. And so, like you said, theoretically, they should it should cost the client less, and it should mean more money for the worker actually in their pocket. But that does bring up a question about, so what about malpractice, benefits, um, credentialing, all of that stuff that an agency would do? How is that handled with your platform?
When it comes to credentialing, it's a very common question. So what we do is we verify the identity of a worker and their licensure. Depending on the type of a license, we go through the board of medicine or nursing board, etc. And by the way, we do the same thing on businesses. We vet them as well, that they're legit, real companies. And when it comes to malpractice, it's a common question, and there's two ways to really answer it. There are some gigs where, by virtue of doing a gig, first of all, sometimes the malpractice is not even required if there's no clinical decision making, if it's some like a chart review or something to go through some kind of assessment where you just collect information. I mean, there's a lot of gigs for that. But sometimes the employer, they will cover a gig worker specifically for that gig. But a lot of independent contractors have their own malpractice insurance, so they're covered with whatever that they do.
While this can be opportunities to do kind of different things in and around medicine, primarily it is going to look very similar to how we practice for the most part. Most part, it's going to be filling in, for a day or for several days, doing typical clinic type work is probably what the majority of you're seeing for PAs and NPs, the majority of the opportunities. Is that correct?
Um,
No. No?
no, no.
Okay.
Well, first of all, it's not necessarily clinic type, because if it's a telemedicine type of a business, I mean, there's a lot of our colleagues, PAs and NPs, they want to start their own telemedicine business. But a lot of what I see on the platform is there are offices that they want someone. Sometimes he has to fill in for somebody who's got sick with COVID or on vacation or maybe on maternity leave. So it's not necessarily just you come in for a day and I'll never see you again. The lot of demand is they want somebody, even the same worker, all the time, but only every Thursday or every Friday. Perfect example. Let's say somebody knows how to do trigger point injections. So the office, they don't want to go through the job ad on ZipRecruiter or Indeed, or certainly not going to use a staffing company or some kind of overhead expense to find that worker. So they can post that gig and say, the requirement is that you know how to do trigger point injections. Assuming that they want an experienced person, sometimes they may want to just train someone. Anyway, so sometimes the gig could be kind of like a permanent gig or long-term gig, but on a certain specific day of the week, and they might prefer the same person.
So that, using that example, because it does make it clear when you use examples, because this
Yeah,
is different to get your head around, because
it's new. It is innovative. So a lot
yeah,
of
yeah.
I'm
So,
already used to it. It's hard
yeah.
sometimes. People are like, really? Does that work?
Yeah.
And
Yeah.
yes,
So like using that example, so say that there is a family practice somewhere that has a couple PAs, NPs, whatever working there, but none of them really either have the desire or the training or the time to do trigger point injections for their patients, but that they may have several patients that they know could use them. And so maybe they decide, like, okay, on this, Thursday, like one Thursday a month or whatever, we're going to offer a trigger point injection clinic. And so they
hmm,
bring in a gig worker who, that's all that they're going to do for maybe,
exactly.
3 hours of the day,
Hmm.
or the full day. They're going to do trigger point injections, and that's it. So they're just brought in to do one specific kind of task. So
Exactly.
that's an
And
example
I
of a
think,
gig.
yeah, and again, we're in the early stage. I mean, we've launched only a couple of months ago, but I think, mark my words, I think that's where the future is, in my personal opinion, for this type of work. Because if any listener there, if they know they're good at something, one specific skill that sets them apart, just like any talent, they can leverage that to their advantage using the platform. So another good example, a real one, is there are colleagues of ours that have a certification to do these Department of Transportation exams, or EMCs, emergency medical condition, I think it's called. You have to really know how it's done. So there's a certain protocol that you have to follow. Well, if you got experience in something like that, you could put it in your profile as a hashtag. That's what you can do. And then if an employer is looking for that specific skill, I mean, it's a match made in heaven. Not to mention, you could probably command a higher price because you're not only your clinician, but you also knowledgeable in a certain very specific niche.
Yeah. And plus you're doing something that you're good at and that you probably enjoy. And so it's almost taking the best parts of what you would like in a practice and then that you're just doing that
Mhm.
specifically. Yeah, I'm really excited now because now I'm getting an idea of what this is. And things started going off my head. I'm thinking about like aesthetic medicine. Like there's so many people that want to get into like injecting Botox or fillers, those kind of things. Let me back up. I get so excited. I think that patients, really want to have kind of a tailored experience or want to have a one-stop shop. And so if you're a physician or a medical group or something and you have this clinic that's seeing family practice patients, you probably don't have the demand for somebody to be there full-time just to do that. But instead of sending those patients out, then you just offer it, like I was saying, every so often you hire a gig worker to come in and then they fulfill the need for your patients.
And same goes with the language. I mean, depending on the geographical area, if you have certain patients that speak a certain language, French, Russian, Spanish, you name it, you could potentially just hire a certain language speaker and just kind of line up the patients that want to speak in their native language. So that could be a gig in and of
Oh,
itself.
wow.
So, and the fun part is that what I'm starting to observe is that you were right just previously when you said it's kind of hard and expensive to put a job ad saying, I just want somebody for Fridays, to cover, Spanish is required. Because it's hard to find somebody like that. However, if they have a gig worker mentality and they do gigs, and they're flexible, they control their own time, then, they're making good money because they're doing gigs elsewhere. Plus, they come on a Friday to see your patients and translate or do whatever.
It is exciting, and I can see why you were excited about this when you start thinking about the possibilities. And for listeners out there, I hope that you're really kind of seeing the picture. I mean, I'm used to kind of thinking outside of the box. That's what I do, and I've always kind of been that way. And locums has been a way to do that, but locums is different because locums is just doing the same thing I do all the time, working at a clinic and stuff, but just doing it in different areas. This can be that, but it also, more importantly, can be taking a skill that you like and you enjoy. Like if you like to do, abscess INDs or toenail removals or like skin tag removals or whatever. I know family practice does not have the time to do a lot of those things. And if they have some people coming in with these things, they can say, look, we're going to need this Friday, we're going to need somebody to have a skin tag removal clinic or whatever. And then they just post it there. And you're the worker, you're sitting there and saying, you know what, skin tag removal is my thing. I love it. It's all I want to do. And you could just sit there and say, oh, look, they want this here on Friday. I'm going to be at this clinic on Monday. And then that can be what you do. It just, sorry, I know you know this, but it just blows my mind thinking about it.
Again, that's what also makes me passionate, but it also gets better than that. Imagine you're in a situation where you want to go somewhere for a couple of weeks or a month, not because of the locums. I have to be careful here, but I don't know, you want to visit some other state or something, and while you're there, you might as well you want to work a couple of days a week here, and as long as it's all verified on the platform, you can kind of combine pleasure with work, so to speak, and plus get exposure to other environments. And there's one thing, if you're the type of a person that already thinks or plans to start your own business in healthcare, you can start as a gig worker, learn how it works and you get some experience. But if you feel like I did way back when I started my surgical assisting business, if you feel like there's more demand and you have the resource to give somebody this work, the platform will allow you to register as a business. And then if they need a worker, like I did for, I don't know, Monday mornings from 8 to 1, they can actually then post the gig on the platform as a business and find the person that they need without the expense of going through job boards or hiring, etc. And they can actually control the price, how much they're going to pay. So I'm starting to envision how not only this platform, HealthGigJobs, can empower workers just to get some work for themselves. I think it can really facilitate and make it seamless to start their own businesses, no matter how big or small they want to get to,
Yeah.
and give them that sense of fulfillment.
So you're saying as a PA or an NP, this platform is great for you to work and get some experience and stuff. But then if you're building, if you want to build a business, then it's also a great platform where you can be hiring other PAs and NPs just piecemeal in your business until you build it to the point where you can bring on somebody full time. So
Yeah,
this is a
exactly
business
like I did.
builder. It's
Yeah,
a business builder. Yeah.
yeah, I did this before several times, and it worked for me because when you're in business, technically you're always working because you want to please your client, right? So if you're going to take a vacation, I can guarantee you, if you're serious about the business, you're going to think in the back of your head, well, what is my doctor or my clients are going to do when I'm away? So you always have this need to have somebody cover you, just like physicians cover for each other. So in theory, where are you going to find somebody? Well, you could use HealthGigJobs. Again, you have to register as a business in order for the matching
Right.
algorithm to work. And you find somebody that you can vet and they're verified and see if they will cover for you. And then you can grow that way. I wish I had this years ago because it makes it so seamless. I don't have to put a job ad. I don't have to do too much interview. And also, I don't even have to go too much with negotiation of a salary or payment because the system kind of does it for you.
So I definitely can see where this is going in the future, but I wonder, you said you've launched for a couple months. What kind of response are you seeing? Like, is this really hard for people to wrap their brains around, or does it seem to be something that people are understanding now and you see momentum building?
The honest answer is no. They are. It's hard for people to wrap their head around. I mean, like when we have a conversation like this, and I can answer questions, in real time, then that makes sense. Right now, I mean, we're getting, again, people think we're a job board. They put their information. It's like, where are the jobs? And like I said, and I have to be honest and transparent with them. Look, you're not going to see a list of jobs that you can just click. You have to be matched to a specific job. So it's just the way it works. Otherwise, we're no different.
So is this something that's available nationwide now, or are you just rolling out in certain markets first? How's the rollout happening?
Yeah, good question. So we're launched in Florida. That's where we started just a couple of months ago, and we're currently launching in the state of Texas. Now, what's important, very important, is that we do allow everyone everywhere to register, and we see that in real time. But on the back end of our system, we can see the pockets of people that registered in a specific city or geographical area. We're very data driven, so we'll use that data to sort of change where we want to market directly, specifically. But obviously our ambition is we are going to be nationwide, but it has to be in a structured rollout.
I just want to clarify that. So you said it is available right now. People can register anywhere in the country. But when we talk about rollout, we're really talking about the marketing and being out there to get businesses interested to register as well. Is that what kind of you mean by rollout?
Yes, particularly when we market to businesses.
So for people who are watching right now, you would encourage them, no matter where they live, if this is something that they're interested in and want to see it grow and become a normal part of the healthcare economy, to go ahead and register. If we want to change healthcare, this is one of the ways that we do it. We are taking control over what, I should say, you are taking control and helping people take control themselves of what they want to do with their skills, and in a very focused way. I'm excited, and I hope that people will consider registering and really helping this platform to grow.
I echo that. I mean, I definitely encourage everybody, if they're interested in that type of work, to at least register so that we know that they exist, because that, again, helps us collect the data and drive, where we're going to apply our marketing dollars.
Any problems with the rollout? Anything that's been surprising that you didn't really think about?
The biggest challenge right now is the trust factor. There's so many scammers out there that are just looking to collect, personal information. And, by nature of our business, we have to verify who the workers are. So we require them to upload their driver's license or government photo ID, because we need to match their name to their license and validate that. And a lot of people are very hesitant to do that. So it's been a challenge, and I needed to explain that we're real and they can check us out. And for the payment processing, we've integrated with a payment processing system. If a worker wants to get a direct deposit, they have to provide their banking information or some form of a where to send the money. Now that we ask after the gig is being matched, so we don't ask it necessarily right away, but at some point we will need that information in order to get somebody paid. So I think it will take some time again because it's innovative platform, it's new, and once people recognize that this is a real thing, then I think we'll get over that.
Yeah, and I assume that you have worked with people to make the site very secure.
Yeah, it's got all the security features, based on the most modern standards.
I just want to say again, I love this idea. And I have to say, even though we've talked previously, I didn't really get it until this conversation about what it is you're trying to build. So this is going to take some time to, for people to really wrap their brains around it and really understand and start utilizing it the way that you have, a vision for it. But if people do that and really understand this and the power of it, this is going to give PAs and NPs so much control over what they want to do and create specifically that kind of practice that they've thought about or dreamed about that didn't think it was possible. So I applaud you. I'm very excited
Thank you.
about this.
Thank you. No, I that's what I'm most passionate about. I want to empower healthcare workers, particularly those that feel stuck. Even if they get paid a lot of money, sometimes you reach that threshold where like you don't even care how much money you get paid. You just need time off and you have this obligation or you have this pressure.
And not only that, but they may be, seeing patient after patient after patient, but they're seeing all different things when their gray love is, skin cancer checks and doing biopsies. And if they could do that, all the time, then that would make the total difference in their practice. But instead, they've got to do all these other things. With this tool, you have the power to make that your practice 100%, doing only the things that you really love and still getting paid well for it.
Yes, and there's one more thing that I want to add to what you just said, which I feel is just as important. Life happens, people have kids, or maybe a loved one is sick or has died. And I think mentally, I think that's where a lot of people start getting that burnout because they're being pulled in different directions or they feel guilty that they're not spending time with their children or their elderly parents or whatever. And I think that's what creates stress in their life, which affects everything. And I believe that the platform like this, and maybe others that will follow, again, will give that peace of mind to a worker that, look, if I need to work part-time, but kind of maintain my, at least minimum level of income or whatever, or spend some time, I can do this, still practice what I know, not to take complete time off, and then I can come back and get another job, etc.
I really do feel like that this has the power to be a major player in healthcare and to be a game changer for so many people. And so thank you so much, Rick, for sharing with us today.
My pleasure. Thank you for your time.
Wow. Okay. I don't know if you got it. I don't know if your mind is as blown as mine is right now, but I went into this interview having already talked to Rick, and I kind of thought I knew what it was. I basically thought it was like a website that would replace a locums agency that would let you, bid on jobs and kind of cut out the middleman, which it is in a way. But after talking to him today, I realize I didn't really understand the potential of what this platform can do for people. I would encourage you to start thinking about what the possibilities could be, thinking about just exactly how you want to practice medicine. And I believe through this platform, eventually you will be able to craft exactly the kind of practice you want. Now, as Rick said, in full disclosure, this is brand new. He's only rolled it out a couple months ago. It's in the building phase. This is going to take time for it to blossom into what it can potentially be. But there are already workers and employers out there connecting on this site. And I would encourage you, as we said, to go ahead and register and just know that you may find some gigs out there, which would be awesome. But right now, if you register, you're really helping them to learn what this platform can do, what people are looking for, and help match up those people. And if you do this, it's only going to help you in the long run and help other PAs and NPs really develop the kind of practice that they want to have. Now, this obviously is not going to be for everybody. So, if you are a PA or NP out there who would like to learn about what it's like working in other specialties or want to hear about some other cool and unusual jobs that PAs and NPs do, then you can watch these videos here or go to my main channel page and look at the different playlists I have. Thanks for joining me today. Take care, stay sane, and I'll see you next time on the Medicine Couch. Bye.